Hello, today we are going to do antiarrhythmic drugs. So there are two types of cardiac action potential, nodal and non-nodal. So nodal cardiac action potential happens in SA node and in AV node. So it happens in SA node and in AV node. And the non-nodal happens in the muscular layer of the heart. So that happens in the muscular layer of the heart. So that means in the cardiac myocytes. So I'm going to draw a cell here. Cell has three ions: sodium, potassium and calcium. The same ions are present outside the cell as well. So sodium, potassium and calcium. These are positive charged ions. So the cell inside is highly negative charged. It's about -70. And these ions are positive charged. And so when it gets into the cell is going to be more positive, and when these ions get out from the cell is going to be negative charge again. So, and the amount of sodium inside is small amount, where in extracellular space it's about 135 to 145, but inside the cell is about 10 to 20 millimoles. So there is large amount outside the cell, where the potassium is large amount inside the cell, about 150 millimoles. But in extracellular space, when we do the blood test, it's about 3.5 to 4.5. That's a normal value. So a small amount outside. The calcium is also large amount outside and very small amount inside. So the sodium and calcium, they are going to go into the cell. Where the potassium is large amount inside the cell, the potassium is going to come out from the cell. Okay, I have done a video for cardiac action ratio for non-nodal cardiac action potential. So please watch that one before you go through antiarrhythmic drugs. So today I will explain non-nodal cardiac action potential a little bit, and then go through class 1 antiarrhythmic drug. And in the next video it's going to be class 2 antiarrhythmic drug, where I'll explain nodal cardiac action potential. So the charge of the cell is about -70. Now the sodium ion, which has positive charge, is going to come into the cell. So the first gate which is going to open up is sodium gate, and the sodium come into the cell, making the cell more positive. The cell -70, and it's going to be positive. And once it reaches up to threshold, the gate closes up, sodium gate closes, and so no more sodium coming into the cell. So next one is potassium. Potassium gate open up, and the potassium is going to go out from the cell. So potassium get out from the cell through the potassium gate, and it's going to go out. So the potassium is also positive charge, so the cell is going to be negative charged. And now when it reaches up to here, calcium gate open up, and the calcium is coming into the cell. Now there are two things happens. Potassium is going out, the cell is getting negative, and the calcium is coming in, making the cell positive. So we get an average deflection like this. So once it reaches up to here, that's the threshold. Calcium gate is closed close up now. So the calcium gate is closed. No more calcium coming into the cell. Now the potassium is still leaking outside, so the cell is going to be negative, and it's back to its baseline, that is -70. So this is called phase 4, the baseline phase. Phase 0, 1, 2, 3. So this is a sodium phase. Potassium phase, potassium and calcium, two things happens here. And potassium phase, where the potassium is coming out from the cell. Now this is called depolarization. This is repolarization. So once it starts to have the depolarization, it has to go through the repolarization. This is called effective refractory period. This is the time period between the depolarization and the repolarization. So that means this is a heart rate. This is a full cycle heart rate. So once a heart rate begins, it has to go through that cycle. So if the ERP is prolonged, that means the heart rate is going to be slower. So in a minute, the number of heartbeat that you're going to have is going to be lesser when the ERP is prolonged. That means the ERP is prolonged, that means it's going to take longer time for another heart rate to begin. So some of the cardiac antiarrhythmic drugs works in ERP. So what it does is it prolongs the ERP and decrease the heart rate. So okay, so the first antiarrhythmic drugs is class 1. They are called the sodium channel blocker. So sodium channel blockers, they are working in sodium channel. So they are going to work in the sodium channel here. So sodium channel blockers. So how does it happen? So when a sodium channel blocker is given, it's going to prolong the sodium channel. So it takes longer time to reach the threshold. So what happens is it took longer time to reach this threshold up to that level. So that's how the ERP is prolonged now, and the heart rate is going to be slower. So this is sodium channel blockers are useful in treating SVTs, AFib, and in Wolff-Parkinson's White syndrome. Some of the examples of sodium channel blockers are lidocaine, procainamide,